All right, let's keep moving on here onto the larynx. I'm going to close my curtain. There we go. So what's the point of the larynx? There are a few pieces to the larynx. The larynx has a thyroid cartilage, often called the Adam's apple, because you can see it externally on people. It's larger in males than in females. The epiglottis is another part of this. It partially covers the opening to the larynx, and that's so that we can gate items that are going to our lungs or to our digestive system. So I'll show you a picture of that in a few minutes. More mucus lining here, and the vocal cords here stretch across the laryngeal interior opening. And the way we flex muscles associated with our vocal cords change the tone and the pitch at which we're able to speak. What's the point of the larynx? Well, air distribution in this particular case. It's a place where air is able to move in and out of our body to our lungs, and also for voice production and communication. Do you need a larynx? I don't know. Maybe I like it. I think it's nice to be able to speak to other people. Singing obviously is awesome. So here's an example, a side view, okay, so a lateral view of the opening into what's going to become the trachea. So this is the, here, let me change my color again. So down here is the very, very back of the throat, the laryngeal pharynx. The epiglottis is this small piece of connective tissue, of cartilage, that's attached to the hyoid bone via ligaments. And this is the flap that, when open, air can flow into the trachea, all right? If this gate closes, then fluid and food can go down through the esophagus, down to the stomach. We'll get to that in another chapter. Vocal cords, let me erase my little line here. Vocal cords stretch across the surface of, or the upper part of the beginning of the trachea here. And if you think about it, the vocal cords, as we go over here to B, are these thin little membranes that vibrate as air flows past them. Here's the epiglottis that will close this, that acts as a flap that will close down the trachea if we're swallowing food or water or liquids, right? And right up here is the base of the tongue. So here's the base of the tongue associated with the epiglottis. In addition, we have our thyroid cartilage here overlying the vocal cords. Males have thicker vocal cords, giving rise to a deeper tone, a deeper timbre to their sound, which causes the thyroid cartilage, or the Adam's apple, to stick out farther. We also have additional pieces of cartilage. Here's the cricoid cartilage, which is behind the trachea, and then you have the tracheal cartilage rings that surround the front of the trachea, but not the back. We'll get to that later. And here's the thyroid sitting atop the trachea, or I guess you'd say anterior to the trachea. And right here we have an actual photograph of a larynx taken with what's called an endoscope. It's a little camera that's inserted through the mouth to look at the vocal cords while somebody is speaking. So what problems can arise with the larynx? Well, there is laryngeal cancer, and this can happen as anybody ages, or laryngeal cancer is very commonly found in individuals who are alcoholics and abuse alcohol. Usually you'll find it mostly in men over 50. Laryngeal cancer can also arise from smoking. And so what happens is if somebody has laryngeal cancer, they will remove the larynx, and then you have what the individual has esophageal speech, where they have to use an artificial larynx to allow them to speak. And that's like a little, it looks like a little microphone that the individuals who've had their larynx removed use, and they put it up to their throat, and they speak through that. It allows them to speak. It sounds very monotone. There's not a lot of detail in terms of the sound quality of the voice. All right, so we are at the larynx, right? Remember I said the larynx on up is the upper respiratory tract. So what can happen to make you sick in the upper respiratory tract? Well, there's rhinitis, nasal inflammation. This is usually due to allergies, cold, or influenza, which is a viral infection. Infectious rhinitis is just a common cold, and everybody catches one every now and again. Allergic rhinitis is often hay fever, and that's what happens usually in the spring and in the fall when flowers and grasses are blooming and releasing their pollen for reproduction. Pharyngitis, a sore throat, is inflammation inside the pharynx, and pharyngitis can be converted to laryngitis. Oops, sorry, right there, if the infection continues going. So you can start with pharyngitis and inflammation. As the inflammation spreads, because the tissue is kind of angry and inflamed, it can spread down to the larynx, resulting in laryngitis, which can go down to epiglottitis, which is life-threatening, because if the epiglottis swells, then it can cover the trachea, blocking breathing, right? And that's a problem. And there's another disease called croup that usually happens in younger children. Croup happens when their larynx swells so much that it's very difficult to get air in and out of their respiratory pathway. Oftentimes, it's not life-threatening, but the children cough, and it's a very characteristic cough. It sounds, instead of, it sounds like a seal bark, like that. And go ahead and laugh. I know it sounds funny, but it's not funny when you see it. And what's happening is the larynx is locking down and blocking the flow of air out of the lungs. Breathing back in is also difficult. You hear them like that. And it's very, very difficult to see. It's very easy to clear up. Croup, oftentimes doctors will give a child an inhaler to clear the croup until they've grown. It's not actually asthma. This one is just the larynx swelling up and locking down. As children get older, though, and their bodies grow, croup becomes less and less of a problem. Other disorders I mentioned briefly: a deviated septum, a septum that goes far to the right or the left out of the sagittal plane or the mid-sagittal plane, like down, straight down your the middle of your head. This can be congenital. Some people are born with it. Oftentimes it's acquired. Somebody will break their nose or just get hit really hard in the nose, and the cartilage or right underneath the nasal bones can deviate and block one of the two sides of the respiratory pathway. And then we have epistaxis, or bloody nose. This can come from all kinds of stuff, right? Bloody nose can come from, just hitting your nose really hard. Hypertension, high blood pressure can result in bloody noses, and other factors can result in bloody noses, including really dry, hot air. The trachea, now moving down to the lower respiratory system, the trachea, also called the windpipe, is a tube that's about 4.5 inches long, depending on your size. It's probably, in me, because I'm little, it's probably 4 inches long, and Shaq is probably 6 inches long, who knows. But it goes from your larynx all the way down through your thoracic cavity and branches out to the bronchi, the primary bronchi that feed the lungs oxygenated air and removes carbon dioxide rich air from the lungs. So that's a part of your thoracic cavity. Of course, lots and lots of mucus here as well. And the trachea has these fun C-shaped rings of cartilage to hold the trachea open. So we don't want the trachea collapsing, right? Or else we'll end up sounding like we have croup, right? Trachea needs to stay open, and those C-shaped rings on the anterior side of the trachea keep them open. So if you feel your throat right now, gently, right around your Adam's apple, you can feel the tracheal cartilage, and it's a C shape. They don't close all the way around. It's not a circle. It's a C shape in the anterior part of your trachea. There's no cartilage. Interestingly, if you just want to know, if you have a Chihuahua, sometimes in the mornings you'll hear them like that. They do not have proper tracheal reinforcement. Their C-shaped cartilage is kind of weak, and their trachea actually collapses. The C-shapes, there are different genetic issues. So the C-shape can be either too small, or the tracheal cartilage isn't strong enough to help them keep their trachea open. So they'll oftentimes, in the morning when they're waking up and they're all happy to see you, they'll go because their trachea is collapsing. And can you imagine how uncomfortable that must be? They don't seem to notice, though. And of course, what does the trachea do? It moves air from the upper respiratory system down into the lungs. And so here's an example of the C-shape. We're looking at the posterior view here. We're looking at the C-shaped cartilage, the mucus coat, and there's lots of smooth muscle underlying the cartilage rings. That smooth muscle can become aggravated in eosinophilic asthma. And so when people are having an allergic reaction, eosinophils, remember in the blood, they love to spit out all kinds of histamine. Histamine makes smooth muscle start closing down. In asthmatic patients, that can cause a blockage of the trachea itself, and extending down into the primary and secondary bronchi as well, because the smooth muscle is really sensitive to histamine. So what do you do if you have that problem? You take albuterol. Inhalers will stop that. It doesn't stop the reaction, but it allows the smooth muscle to relax. So the trachea, the windpipe again, if there's an obstruction, that's a bad thing, because if you can't get the obstruction out of the way within a few minutes, that does cause death. The individual will basically pass out. And due to tracheal obstruction, as of, I think this was 2010, about 4,000 deaths in the United States happen annually. The Heimlich maneuver is a trick where people can, or technique where people can free whatever has gotten into the trachea, the tracheal obstructions, and allow the individual to breathe again. Tracheostomy is a procedure where a tube is inserted through an incision. They poke a hole into the trachea and basically put a tube in there. Hopefully it's sterile, right? Kind of like a straw, to help the person start breathing again if their pathway is blocked and they can't breathe. That can be fixed later. Okay, going farther down into the lower respiratory system, the bronchi, bronchioles, and eventually the alveoli. So the trachea branches into the right and the left bronchi. The right primary bronchus is more ventral than the left. So on your right side, it kind of points more to your back, and on the left, it points more towards your chest, okay? If items are aspirated, they lodge typically more often in the right, because the right primary bronchus happens before the left. It's a little bit higher. Each bronchus branches into smaller bronchioles. They still have a mucous membrane inside of them, and they still have smooth muscle outside the mucous membrane. No C-shaped cartilage here, though. And the bronchioles end in the alveoli, those little tiny sacs where gas exchange occurs. So what's the point? The bronchi and bronchioles, air distribution, just to make sure that air can get to the right and the left lungs. And then the alveoli, of course, we talked about this briefly, is where gas exchange happens between air and the blood. So here's an up close and personal picture of alveoli with a bronchiole coming in to what we call an alveolar duct. The alveolar duct connects the alveoli themselves to the bronchiole. Each alveolar sac, like I mentioned before, is surrounded by a capillary bed fed by a pulmonary venule. So you have a venule spreading into the capillaries, and then a pulmonary arteriole. And remember, the venule is actually going out. I was pointing the wrong direction. That's why I said I'm sorry. The venule is taking oxygenated blood out to the heart again, and the arteriole is bringing blood in. And remember, this is the part in the body where deoxygenated blood travels through an artery and oxygenated blood travels through a vein, or arteriole and venule. So what happens when the bronchioles and bronchi and alveoli aren't working well? Well, we have a few examples of respiratory distress. This distress is the inability to inflate the alveoli. Basically, the alveoli can collapse down. Infant respiratory distress syndrome, IRDS, is a situation that happens with premature infants because some of the cells in the alveoli aren't producing that surfactant, and the alveoli collapse. Think about the inside of the alveoli being like pieces of bacon. When you put two pieces of bacon, they stick together really well. If you were to actually put a little bit of soapy water between the two pieces, they don't stick together as easily. That's what a surfactant does. It breaks up that surface tension and allows the tissues to separate. Adult respiratory distress syndrome, ARDS, which sounds kind of crazy, is where, again, we have a surfactant dysfunction, and it allows foreign substance, it's an impairment of surfactant production, and foreign substances or genetic diseases can be the reason why this impairment occurs. And what happens here also is that the alveoli collapse down. and the person can't get oxygen.